I say all of this to say I love being able to offer the concierge service, being able to see people at their best, keep them functioning at their best, and be a part of their preventive care that's going to prevent that stroke, that's going to prevent that high blood pressure, that's going to prevent that, that diabetes or the obesity. So is that the kind of care that you give with your house calls?
Yes, absolutely. Absolutely. So we do preventative care as much as possible. A lot of times, that can be challenging because we are getting people with comorbidities and dementia is a large part of our population. And so, but yes, but as you were speaking, preventative care can happen either way, whether anyone has comorbidities or not.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra, and today I am joined by two fabulous co-authors. So for those of you who may not be aware, I am a co-author of an anthology, and the title of the anthology is Act Like a Nurse, Think Like a Boss. Now, this anthology comes out of the Nurse Boss Summit. The Nurse Boss Summit was founded and is organized by Dr. Tammy Lewis, and she's actually heading this project for this anthology, and we are all a part of it. So today we're going to talk a little bit about that, and I have two of the wonderful authors. First, let these lovely ladies introduce themselves. And Dwan, why don't you let everyone know who you are? And from you, we'll go right to Dr. Natasha.
All right, let's go. So I am Dwan Thompson Kelsey. I am a nurse practitioner. I currently practice in Raleigh, North Carolina. I am the owner of Well Life House Calls, which is a medical practice that specializes in geriatric adult care, primarily in adult living in family medical centers or family care homes in the state of North Carolina.
Dr. Natasha, take it away.
Hi, thank you, Dr. Lendra, for the invitation. I'm happy to be here. I'm Dr. Natasha Ramental. I'm a registered nurse and board-certified patient advocate, and I have a doctorate in health sciences, and I do a lot of things, including having a medical tourism channel on YouTube where it caters to Black women that are interested in seeking healthcare abroad.
Awesome. So as you can see, amazing things are coming out of the nurse boss community. I love that we are women of color doing our thing. So let's talk about the book. So we are all co-authors of Act Like a Nurse, Think Like a Boss. And I guess my first question, what made you want to be a part of this anthology and what readers can expect from this book? Dr. Natasha, give us a little bit of overview about what the readers can expect from your chapter of the book.
Sure. So what made me want to be a part of this project, honestly, when you heard what it entailed with all of these amazing other nurses who have gone on to be entrepreneurs in a number of different areas, that alone spoke to me. The fact that they were all doing exceptionally well in those areas, and the commonality was nursing. Right? Our nursing skill sets and using it in a completely different way. And it spoke to me because I'm actually a second career nurse. I was actually not involved in healthcare at all. I was in international relations and international development. And I pivoted after a personal tragedy, losing my brother, unfortunately, at the age of 32. And that's what made me decide to sort of revamp my life, go back to nursing school, and become a nurse in the emergency department. And then I served in a number of other roles. And my chapter kind of discusses exactly how I pivoted from another industry, but then also pivoted to different areas of nursing until I found what I considered to be my niche or my area of expertise that I thought just fit really well with where I'm going in terms of patient advocacy, and how it's even blended my past life in international development by medical tourism and making that blend with the patient advocacy piece. So that's what my chapter covers.
I love that because there's so many second career nurses, and that's an inspiration. I know as a nurse leader, I would hire second career nurses all the time. And a lot of times, especially if they came from business, they had a different mindset, right? Because they had a business mindset, and they were some of the nurses who were easiest to train, believe it or not, when it came to nursing, because a lot of them came. So let me be careful on how I say this, but a lot of them came because they had a purpose, like you did, right? So you had something that went on in your life, and you said, you know what? This is I want to be a nurse because of your circumstances. And that I find that a lot in nursing, that a lot of times people, even if they come out of high school and they go to college and they become a nurse, it's because of some type of experience that they had, and that's what led them into nursing. And I guess that segues me over to you, Dwan, and tell me, is that your experience? Was that your experience? Did something happen that made you want to be a nurse? Or talk a little bit about that.
Sure. No, I actually kind of went the traditional route. So I knew
Okay.
that I wanted to be a nurse in high school. I was somewhat motivated and influenced by a cousin of mine who's a little older than I am, who was going through nursing school when I was in high school. And so I kind of saw her journey as someone that I really looked up to. And so she was really the motivator behind. So I kind of went the traditional route. And so I was a nurse for a few years. And then I decided to return to school to receive my master's for NP. So that was kind of my journey into nursing. And so that career really has been wonderful for me. I did bedside nursing in the beginning, and I absolutely loved it. And then I just said, there has to be more. And so that was the energy that was behind going back to school.
For me, I became a nurse because it was offered to me, and the way it was explained, like, hey, it could be a great career. And I've shared this story before on the podcast. I actually went to school, was offered the LPN program, so I wasn't offered like a 4-year college program. It's just where I grew up. We weren't really expected to go to college and so forth, but that's a whole nother story. But it was like, hey, we have this LPN program that's being offered by this vocational school, which I was accepted into. But what happened was, when it was time to enter the program, the school actually closed down. But we all were deferred to the county college RN program, and the rest is history. So it was like, all right, well, okay, I guess I'm going to be an RN instead of an LPN, and the rest is history. So, Dwan, from your journey, share a little bit about what you're talking about in the book. Are you pulling your journey into your chapter of the book? Talk a little bit about that.
Sure, sure. So the book is very exciting for me. And the book really allowed me to kind of go in a little deeper to understand the journey. Because, it's oftentimes you kind of own your journey and this, you're doing this and you have such a bright idea and, it materializes or it doesn't. But then you kind of move on to the next. And then you kind of get to that pivot in the road that says, hmm, now why am I doing this? And so then you have to kind of look back on your career and where you've been and the good, the bad, and the indifferent. And you have to just say, okay, this is, let's start putting the pieces together of this beautiful puzzle, because at the end of the day, it is a beautiful puzzle. But I think we forget about the pieces that's making this puzzle. So I said all that to say is, my part of the book really talks about the why, because I got to a place where it was like, what is my why? Like, what am I doing? I've been very blessed to be able to do all three. So I was very blessed to do clinical, I've done academia, and I've done research. So I've done that, a very blessed opportunities. However, what is my why? And so I talk about that in the book. Why am I doing what I'm doing? What led me to this point? And at this stage of the game, what is propelling me to that next, to that more, to that greater, to that next level? And who am I bringing along with me? Because I haven't been on this 30-year journey just for Dwan. I've been on this 30-year journey to pull those behind me, in front of me, beside me, and say, come on, girl, let's go. And so that's where I talk about a little bit about the book. It's just understanding the why.
That's so powerful. It really is. People probably won't admit it. When you don't know your why behind what you're doing, you lose your purpose, right? If you don't know your why, what happens is that's how you get lost. And that's how people, and let's just say when they start their businesses, what happens is they start going down rabbit holes, right? They start getting,
Right.
what do they call it? Like the shiny object syndrome, right? Because you're not focused. You don't have that
That's right.
business plan, and that business plan should reflect your why. That business plan should reflect your purpose. Why are you doing this? And if it doesn't, that's how you start chasing you can never get ahead. You start chasing every shiny object in the business world because there's a lot of them out there. And what happens is we can get so lost. So I think this is so powerful for people to understand their why. What do you think, Dr. Natasha?
No, I agree. And I also think it's important to say that your why changes over time. It evolves just like you do. So at different points in your life, you may turn a different direction simply because your why has changed a bit.
Mhm. Mhm.
Perfect. I mean, you couldn't have said it better, right? So for me, getting into entrepreneurship was more about because of my experience in nursing leadership. So that experience, the bias that I experienced, the burnout that I experienced, right? So now I lead the Burnout to Breakthrough movement. So what does that breakthrough look like? There's life after that, right? So how do you reclaim that joy? How do you reclaim that purpose? Because you don't want to get stuck. It's really, really easy to get stuck where you are, and you have to be able to understand your why, understand your purpose, because guess what was happening, that was preparation for me, when now I'm able to help other people break through, right? Break through so that now you understand what your purpose is and you can move on. And I guess that kind of leads me into talking about your why behind the medical tourism, right? Like, talk a little bit about the medical tourism and your why behind that.
So medical tourism RN came about simply because with my emergency background experience, I'm in South Florida. So I was in a heavy populated area where it was Latinos and Black women. And I worked in an emergency department in Miami. And I noticed that a lot of the women that were coming in with botched surgeries, predominantly cosmetic surgeries, they had been done abroad. Simply because of the price, just affordability. And what was going on, as you all know, it's a litigious society here in the United States. No physician wants to touch another physician's work. So it was difficult to always find some type of solution for them. And I was just like, why does this keep coming in and no one is saying anything about it? So I figured that basically it required education. So I just said, let me start this channel, because I usually do, through my church and that kind of thing, I do educational sessions on patient rights, patient advocacy, those types of things. And I said, you know what? You have to arm people with education so that they can make the best decisions for themselves. And so what I did was I said, let's start this channel. Let's see. I didn't expect it to go very far, but it has, thankfully. But essentially, it's dedicated to Black women. And I'm educating them because, as you know, Blacks have the highest rates of almost everything out there in terms of death, maternal mortality, and so on and so forth. So I educate them on how to properly vet physicians and facilities, which locations may be the best for whatever type of surgery. But I also arm them with information that is evidence-based on what has been shown in terms of any aspect of healthcare that affects Blacks and Black women differently than others, because where they're going or choosing to go are places that we are underrepresented. So maybe those physicians might have the accreditation and the skills as well as the certifications, but if they don't take care of Black people or on a regular basis, maybe they're not in tune to that type of evidence-based information that's out there. Things like recognizing that as a head scan, a CT scan of some sort, or an X-ray may show up differently and show up as an artifact, when in fact it's because we have dreads, locks, or braids in our hair. If you go to a place where people don't have Afro textured hair and aren't wearing braids or locks, then you're not going to pay attention to those things. You may think it's frivolous when it comes across your desk, but it's important for us to know and to share that with physicians, so that when they're looking at our results, our images, our lab work, all those things, they take that into consideration and don't frivolously order additional tests that we may not need.
So, what kind of education can your viewers or part of your community, like, what can they expect? So, what kind of education do you share?
So all of it, as I said, is evidence-based, but it's essentially, I do pay attention to topics that are coming up in peer-reviewed journals, but I also pay attention to what's going on in the news, popular places that I know people are going for specific procedures. And I don't just cover cosmetic. It's cancer, it's maternity. A lot of people are leaving the US to now give birth abroad, fertility treatments, anything that you can think of. It's all healthcare based, but also giving them information on things like, make sure if you're going to this particular country, you look into X, because that is not necessarily something that is legal there. And when I say that, an example is fertility treatments. If someone wants to engage in IVF or egg exchange, in certain countries, you may have to have it by a relative. They don't allow eggs to be exchanged, even if someone is willing to do it, unless it's a relative. In other cases, you may have it where they don't allow members of the LGBTQ plus community to do this, because they don't believe in it. It's unlawful in their country. So a lot of different types of education. And I also take requests. I always ask my viewers, please, if you have something you'd like me to cover, mention it in the comments, and I have no problem covering. And I also answer questions. A lot of them submit questions, and I'll just do a review of the answer on and put it out there for them as well.
Awesome. So we'll make sure that we put the YouTube channel in the notes, in the show notes. And Dwan, that kind of brings me back to you. So I know we're talking about the why and the purpose, and what exactly. I know you're in the book. You're talking about the why. What exactly are you helping your community with?
Sure. So with the Well Life House Calls, we are a medical practice, and our primary mission is to bring medical practice into the homes, because we know that a lot of individuals cannot get out of the home, one, due to access, limited mobility, caregiving issues. All of those really impact how people are getting care. And so we find that in family care homes and in assisted living facilities, that sometimes they may not be getting the most optimal level of care. And so we bring that to our residents, to our patients. We also bring that family centered care. My father was in a family care home. And if it was not for those people at the family care home, I think our experience would have been totally different. They were absolutely wonderful people who cared for him, and along with the other residents, but who cared for them, but also who was very intentional about making sure that his medical care was met as well. And so it wasn't just the care, the physical care of ADLs, it was his blood sugar is low. I think he has a fever. We need to do something. And so that is what our hope and our desire with the Well Life House Calls is to bring that same level of family care and just good old medical care to our patients and to our residents in those different facilities.
Awesome. Talk a little bit about, you shared that you have a diabetes clinic, or you did some pharmacy specialization. Is that what you're doing now with
Yeah,
the
so
house calls?
well, no. So before life, so another piece of this puzzle, I owned a diabetes clinic, and it was one of the first diabetes clinic of its kind in the state of North Carolina. And so we were able to bring. At one point, we had people could come in and exercise. We had food, because we understand that that was to understand just the impact that good nutrition has on diabetes, but just in overall health. And so we kind of brought that to the community. Instead of asking the community to go to good food, we also understand that there's food deserts, and food deserts exist everywhere. And so, so we were bringing good nutrition food to people. And so, that piece of the puzzle was the diabetes clinic. And in addition to that, I actually have a pharmacy, a specialized infusion pharmacy. And so when I talk about, for my journey, when I talk about the why, we can put these pieces together and they can be successful. But then, you look back and you say, what is the common thread? Why? What is the why behind all of these different pieces? And that kind of really led me to house calls, because yes, I was very good at diabetes. In pharmacy was a little different because I am a clinician. I practiced for over 30 years. So I'm a clinician. I'm a clinician by heart and I'm a clinician by mind. And so, that was that was somewhat of a learning curve. And so that's kind of where I had to really reassess and understand my why, because part of that why is understanding who you are. And as Natasha said, understanding who you are in that particular season. And so, but you got to understand who you are, because as you said earlier, if you don't know that, then you begin to start chasing. And what you're actually chasing is, I'm chasing who I think I am. And so I had to get to the point to understand I am a clinician. And I love patience. And I love seeing excitement or disappointment. It doesn't matter, because, as nurses, we can roll either way. And so, I love that. And so that was why I went back to house calls and said, this is my peace. This is my passion, and this is my purpose. And so that's kind of have been my journey. But that's Well Life House Calls. I know that was a little more, but that's where we come with Well Life House Calls.
I love that. I appreciate that. Having a concierge business myself, I love the empowerment of being able to come to someone's home and doing nursing on my terms, right? So in the traditional setting, whether it was as a bedside nurse or as a nurse leader, there's so many rules and there's structure. And but when you see these patients or clients outside of the hospital, they're so different. And I love the healthy side, right? The healthy journey. So my business is about preventive care, right? So we come to you, we offer IV vitamin therapy, we offer weight loss services. So these are people who are, they don't want to have, high blood pressure, right? They want to stay healthy. They're all about preventive care, and they're fine with paying out of pocket for these services. So being able to see patients or clients on that side is such a breath of fresh air, right? As opposed to always seeing people at their worst when they're sick. And that's when you in the hospital. And I'm not sure which one of you, or if it was both of you, who said the sick care, right? Like we talked about
I
the
said that.
sick care, right? Like
Model here.
it takes a toll on you to always see people when they're at their worst. And for me, being in the inpatient setting for almost 20 years at the time, it was like very rarely you got to see someone, they would come back like when they were walking around and you would be like, oh my God, like Mr. So-and-so or Mrs. So-and-so, they look great. So for a while I worked in bariatrics for quite some time. So, when you would, you see the people when they would have their surgery, and then they would come back, maybe either it was for a complication or it wasn't, right? But you would see them 9 months later and they would be like, look like a different person, and they would look so good. But really you got to see people come back from like a stroke, because I worked in neuro for quite some time. And rarely you got to see the people on the other side of the stroke. So I have a good friend who she worked in the outpatient setting, and she would be able to see the people who would come in, and they would come in for their OT after having a stroke. So she would be able to see them, but we don't get to see that on the inside. It's like they leave off for rehab, and it's just like, all right, good luck to you. I hope everything is fine, unless you have a family member who come back and show pictures, or unless they come back in for whatever reason, but it happens so rarely. I say all of this to say I love being able to offer the concierge service, being able to see people at their best, keep them functioning at their best, and be a part of their preventive care that's going to prevent that stroke, that's going to prevent that high blood pressure, that's going to prevent that diabetes or the obesity. So is that the kind of care that you give with your house calls?
Yes, absolutely. Absolutely. So we do preventative care as much as possible. A lot of times, that can be challenging because we are getting people with comorbidities, and dementia is a large part of our population. And so, but yes, but as you were speaking, preventative care can happen either way, whether anyone has comorbidities or not. You just have to be intentional and purposeful around what are we putting in place to keep these people from not advancing in their disease state, and to prevent other disease states from happening in light of what they're already going through.
It's funny. I just want to say something to that, because the whole sick care model that you brought up, I said that because literally where I live, a mile east of me, west of me, and north of me, they're building standalone ERs. And I said, man, all this money to build standalone ERs, but they're not building something like a clinic that's specific to chronic illness to prevent people from coming in, because in the ER, people use that as primary care anyway. That was a big thing that I saw. People couldn't leave their job, lose the money for the day to go to their doctor, or they don't have insurance. So they're just like, they wait till it gets so bad that they come into the ER, and that's where they get it. And I said, man, everywhere I look, and we have plenty of hospitals also, but to see standalone ERs being built, new structures, east, west, and north of me, I said, man, instead of investing in preventative care, where we could put our dollars, it would save so much money if we kept people healthy.
It would. And right now, with all of and I know I don't want to go down this rabbit hole, but right now, with a lot of the Medicaid cuts, right, with a lot of the cuts that are going to happen in healthcare, there's going to be so much sick care. However, preventive care is going to have to be the vehicle right now. That's going to have to be the vehicle. So for anyone out there who's listening, who has insurance currently, go and get all of the comprehensive exams that you can get right now. That includes your physical, your mammograms, everything that's free, your dental visits, whatever you can get right now. Now is the time to do it before you lose your benefits or whatever that modification is going to look like. Even hospitals are closing. So we're building these emergency rooms. I'm curious to see how that's going to be affected in 2027, right? With all of the cuts that have taken place. But to your point, why not invest in that preventive care? And that's why preventive care and what we're doing is actually going to and this is my opinion, I feel like it's about to explode, because people are going to continue to need concierge services, because guess what? Right now, currently, you're right. People, they use the ER. They can't get a doctor's appointment. So what do? They use the ER as a way of getting urgent care, right? Getting care on an immediate basis. Otherwise, if they call their doctor, they may have to wait 2 to 3 weeks. So you know what? I'm just going to go over to the emergency room. And that's not really the way, but we haven't educated our communities enough on how you're supposed to use the ER, which causes overcrowding. So what's going to happen now with all these Medicaid cuts? Again, I don't want to go down that rabbit hole, because I already see hospitals closing. A lot of different funding is being cut. So what does that mean? Preventive care, concierge medicine. I don't want to say like it's a great time for nursing, because it's also a sad time. But if we want to be able to help our communities, house calls are the way to go. concierge medicine might be the way to go. Is there anything that I didn't ask, that I didn't share? Please jump right in and talk about it.
Yeah, I just want to know, even though my YouTube channel covers specifically, it caters to Black women in medical tourism. Medical tourism doesn't always mean outside of the country. You could be going to another county or state in the US to receive medical tourism, a treatment that is just more affordable or accessible to you. And that is my YouTube channel, but I'm also I have my Medical Tourism RN business, which is a patient advocacy business, which is for everyone. It's not only for Black women. It's telehealth virtually, and it's also in person. I will help with if communication of clinicians. I can help with the appointments. I can help travel with these individuals if that's what they desire, or also just vet if they would like me to do that. So there's a lot of services I offer under the umbrella of the patient advocacy business, and it's for everyone that's out there, whether they're in the U.S., interested in services in the U.S., or even going abroad. So I did want to just make that distinction, although the branding is the same, Medical Tourism RN.
No, thank you for that. That's good. That's good. And so how can people find you?
On all social media, I'm Medical Tourism RN, and YouTube is where I have all of the videos with the education, and that's Medical Tourism RN 812. But I'm on YouTube, Threads, TikTok, everything, Instagram, so you all can find me there.
And how about you, Dwan?
Wanted to put in a plug about the Nurse Boss Summit. And I was at the first. I've been to all of them, and I was at the first one. And I'll just share a quick story is that when I walked in, I do know Dr. Tammy Lewis, who is an amazing nurse leader. Who is a motivator, she is definitely a person that's able to bring people together. And I remember the first year in 2020, right before COVID hit. There's many stories that have come from the Nurse Boss Summit of how instrumental it has been in just nurses in general, lives and businesses, and how people have been able to make connections and been able to network. And I know several people, personally, whose businesses really flourished from attending the Nurse Boss Summit. It's just an amazing event. And so I just want to just really highlight the Nurse Boss Summit, because I know for me, it has just been very instrumental in networking. Shout out to Tammy Lewis and the Nurse Boss Summit.
Yes. Well, there you go. You just did my wrap up. So I don't even have to say anything else. So there you have it. Seriously, you did a great job with summing it up. Looking at the book, we're just 3 of the co-authors of the anthology. More to come. This is the first of the Act Like a Nurse, Think Like a Boss anthology series. And I just want to thank you both for coming on and sharing your stories, sharing the overview of your chapters. People have so much to look forward to when they actually grab their copies of the book. Dwan, I'm not sure if you shared how people can find you.
Sure. It is WellLife, www.welllifehousecalls.com.
There you have it, guys. Until next time, make sure that you stay inspired, stay educated, and stay empowered.